I'm already fully vaccinated. Should I still get flu shots? Great question. So, so what I've been seeing mainly from the pediatric point of view is there's a virus called respiratory syncytial virus, RSV, which is common in adults and pediatrics, but is really only occurs in the winter. What we've seen when we took off masks in May and June is this winter virus making a big surge in our pediatric patients. Um, and that is something that we don't really see. So the reason why I mentioned RSV is that it's a respiratory virus, kind of like the flu. And what I expect, or what a lot of us are thinking about in the healthcare field, is that the flu will probably come surging back this fall and winter because everybody's been traveling throughout the summer. And the flu is really a seasonal respiratory infection that gets traveled from different parts of the world during their winters. And so I expect this year we see more of that twindemic that people were talking about last year, only because we've opened up so much throughout the summer that the flu has probably had a chance to spread. As far as the flu shots, I highly, highly recommend anybody, if they're able to get the flu shot this year, and actually every year, to be honest. And the reason for that is you don't want to be fighting two infections at the same time and wearing out your immune system. And also having any vaccine will actually boost your immune system slightly. So for instance, if you get the flu shot, it will boost up your immune system, your innate immune system, and it will have, for instance, it will have a lot more security guards around your body for the flu season. And when you have more of these innate immune system, antibodies and signals in your body, it can also help detect COVID much faster. So for instance, I've seen patients who get flu vaccine or MMR or anything like that earlier in the year, and they actually have a little bit more protection from COVID. And there was actually a study, I think, done last year showing that those who had the flu vaccine had less severe symptoms from COVID. And that is because your innate immune system, which catches everything, is a lot more active after a vaccination. So yes, get your flu shot, and you can actually get your booster and flu shot at the same time. So I'd also tell people that as well. And that's mentioned by the CDC and the ACIP as well.